Good afternoon, everybody, and welcome to the Board of County Commissioners Workshop. Would you please rise for the Pledge of Allegiance? I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Okay, well, right off, we have the 22nd Judicial District update from Judge Plewe and Eric Hogue. Come on down, gentlemen. Grab a mic, pull it as close to your mouth as you possibly can so that everybody in YouTube world can listen, and it's yours.
All right, well, thank you for having us over again this year. Appreciate it. Just wanted to give you a little bit of update on our judicial district, where we're at, answer questions you may have that I can answer. Just to get you an idea, we have 55 employees here in Cortez at the courthouse. That includes probation and the trial courts. So those are good jobs for our community with benefits, and we have a really solid group of hardworking employees that we enjoy working with. Just to give you some ideas of our numbers, district-wide, our district includes Montezuma and Dolores counties, but the Dolores County docket is somewhat minimal. So if I give you a district-wide number on cases, it gives you a pretty good idea of what's happening in Montezuma County. In the district court, we handled 307 felony cases in the fiscal year that ended June 30th of 2023. So those are the most recent numbers we have. 170 civil cases, 164 domestic relations cases, juvenile cases 175, 14 mental health cases, and 194 probate cases. So we're busy in the district court level. There are 2 district court judges. On the county court, our Montezuma County court docket handled 573 civil cases. So those include protection orders, money collection cases, eviction cases, misdemeanor 670, and 446 446 infraction cases, 43 small claims cases, and 523 traffic cases. I can tell you on a statewide basis, I think that our district and county court get cases resolved faster than most districts in the state. We have a very high success rate of finishing our cases in a timely manner. And perhaps, Eric, you can jump in here real quick and just tell us where we're at as far as a county judge, as far as our FTE for our county judge, that's kind of where we're stretched. That's a busy job for a county judge job.
It is a busy job. So I just served on the working group for the state that reevaluated the methodology we use to calculate how much time is needed for a county court judge, either part-time or full-time, to do their docket, to do the workload that's associated with it. And so right now, Montezuma County moving into Class B county last year has fallen into what's categorized as a small urban community. And so it's a small urban categorization for us. That current workload for Judge Lawrence in there is 1.25, so she's doing the work of a full-time county court judge plus an additional quarter-time county court judge. So in the Class B counties, of which there are 7 of that fall in that Class B county, where there's one single full-time county court judge there, she falls right in the middle at about 89% staffing level where she's at. So she is... We're not due for any additional resources for Montezuma County as it works to the county court docket yet, but she's one of the higher staffed, or one of the higher workload Class B single county court judges in the state. So it's a pretty substantial caseload that she carries by herself. And it's going to be that way for the long-term foreseeable future. Yes, yeah, it is. It's going to remain like that. There could be potential magistrate resources in the future, but that's unlikely to be seen for the next probably 3 years at a minimum. So
how do they evaluate? I mean, what's the trigger point if you're doing the workload of another quarter person? What?
That is about the trigger point right there, is about 0.25 when you get to that. And so we're right at that cusp. I don't expect, though, to see magistrate resources for which will be FY26 next year. We're working on that budget request right now. I'm also on the working group that's putting that together for the state judiciary, and so I don't expect to see any magistrate resources where, we bounce back and forth between 0.23, 0.25. We're right in that realm, and so it's just not enough to pull that lever just yet.
And district court, where we, why don't you let
District court, we are 6th in need in the state for some additional time in the district court bench. We have 2 district court judges right now. Our workload is 2.69, but we do have a magistrate currently. Magistrate Taryn is our magistrate, which works on the district court docket. So that offsets that. So we're currently 6th in need for resources, which would be potentially in FY26 some additional magistrate time in the district court realm to help offset the district court judge workload.
But we're probably looking a decade out
Yes.
for another district court judge.
Yeah,
And frankly, that's probably going to happen before a county court judge.
I would think that would happen, but I think a 3rd district court judge is likely to happen before a 2nd county court judge. And as that county court judge need goes up, until it gets into the 0.85, 0.9 realm, it's just additional magistrate time until you reach that point where a full-time allocation comes. Because Class B counties can't be allocated a part-time county court judge, it's a full-time resource. So they offset with magistrate time, and then when county court receives an allocation, the magistrate is reallocated and pulled back.
So we have the extra courtroom right now that the magistrate is using a couple days a week, and I don't see that any additional need for courtroom space for the next decade.
No, we built that building on 25-year need. This September will mark 7 that would have been in there, so I think we're on track with what we had predicted originally for that facility for capacity.
So that's good, and we just wanted to share that with you, just so you were aware that that's where we were at, and we appreciate the facility that we do have. As far as our probation department goes, we have actually, as of May of this year, our probation department was supervising 570 individuals, which is a pretty high load for that department. One of the things that we have done that in the last year that we think has been good for the community is we have added a law clerk position where we get a recent attorney graduate from law school, and we've had one this last year. The idea behind that is to hopefully get young attorneys to come down to our community, to Southwest Colorado, to Western Colorado, see the benefits of how wonderful it is to live here and what a great place it is. Hopefully they'll stick around. We're going to do that every year with one attorney for a 1-year contract, so they won't be able to stay on longer. It's going to be 1 and then move on to something else. And we're also participating in the Greater Colorado Summer Intern Program. So we actually have 2 summer interns, law students, who are also with us this summer. Same idea, same concept, try to bring young professionals into the area, let them see what practice in rural Colorado is like. It's something that I've seen a need for as the chief judge. We don't have as many attorneys here in the community as we used to, and that affects us as a court when we try to appoint individuals to represent people that need representation in court. We just don't have the numbers we used to, so we're trying to do that. One thing that you should be aware of, and you probably already are aware of, is that pretrial was discontinued, pretrial services. That actually happened today. That's not why we're here today, but it happened to coincide with July 1st because of the MCSO budget. So we've set up sobriety monitoring as is required for DUI offenders, some DUI offenders, and we'll do our best to promote public safety, but it's going to be difficult without pretrial services. So basically the court's just going to be referring people to a local testing entity and using our staff resources, which are limited, to monitor those individuals. It's possible that you may see a rise in the jail population without pretrial. So I guess we'll see this time next year where we're at. We'll keep an eye on that and let you know. So that's what I have. I just want you to know we're doing good work. We have some very dedicated employees who enjoy what they're doing, and we appreciate the facility that we have, which is still one of the best in Colorado. So.
Thanks. I don't know if you have any questions for either of us as it relates to any of the topics that Judge Plewe was talking about. If not, I was just going to talk about some of the facilities itself, some things that Travis and I worked on both last year, and we have some meetings coming up, I believe, next week on some other things. But do you have any questions on?
I do.
Okay.
I do, because you were talking about budget. So I have a question for each one of you.
Sure.
So, and Judge Plewe, I'll ask you first, because you just mentioned that because of the MCSO budget as far as pretrial. So explain to me what happened there, because as far as we know, there was nothing changed. And I mean, am I wrong?
I don't want to, I'm not here to represent the sheriff's position, so we've met, the pretrial program itself was not, be careful here, my understanding, what was represented to us, and I certainly believe that representation was not paying for itself. Individuals paid, but it didn't pay for the program.
Okay.
And so the sheriff made a decision to reallocate resources away from pretrial and use that deputy time for other things in his department. We're not the only county in the state that doesn't have pretrial. Pretrial was something that the legislature came up with, over a decade ago, and it wasn't a mandate, wasn't required, but it was an unfunded suggestion, strong suggestion. I guess that's the way I would describe it. And so that, and you all know that becomes difficult, and we started pretrial services here, and it served us well, and we've appreciated it. But that, the sheriff approached me about discontinuing pretrial, and I certainly respect the fact that he has his budget and his priorities that he has. And so we worked with him I can't make the sheriff do anything. I can't make you all do anything. I can't make anybody do anything. So we work together. We have a great working relationship with Sheriff Nallen, and I appreciate that. The decision was made by his department that they didn't want to continue with pretrial services. I respected that, so we've pivoted, and hopefully individuals will still be monitored. They won't be monitored by law enforcement, so they won't be reporting to a deputy, so there's a big difference there, right? And we know that. I understand that. We've allocated some of our time within our staff to help monitor that with the recovery center, so individuals will still be testing. They just won't be reporting to someone at the sheriff's office, a sheriff's deputy. So we're hopeful that our response time will still be adequate if individuals are not compliant, but I'm not in the monitoring business. I mean, that's just not what I do, right? And so, we're in the same boat with a lot of other counties in the state that don't have pretrial because it's expensive to monitor individuals. I get it. I mean, they're supposed to pay every month. If they don't pay, then what do? You can't put people in jail just because they can't pay. That's not constitutional. So we're doing our best. That's what I would share. If you have more concerns about it, please talk with the sheriff, discuss with him what's going on there. I don't know what it's going to do to the jail population. I don't. We'll see.
Yeah.
And there are a lot of other factors that affect our jail population that may not be related to this. We're going to try to track it. We're going to try to keep the numbers, but we'll see where we're at. Next year when we talk, we're going to have, a different conversation about that.
Okay.
I mean, there are other things we can do with it other than the sheriff's office. There are some counties who've made a choice to allocate other resources to a pretrial program. So I guess we'll have that conversation at a different time. I'm happy to talk about it. Do you have other questions about that, Mr.
No,
Kendler?
that was all I was going to ask you, but then I was going to ask Eric a budgetary question too, because it sounds like you put together the budget for the entire for the court?
I'm one
Courts.
person. Yeah, one person on that
One of a
group.
team,
Yes,
yeah.
yes.
So, how many, well, let me ask you another question first. You have 4 courtrooms, right?
Yes.
And you're using one, you said, for the magistrate now?
2 days, 2 days.
2 days a week?
2 days a week.
Yeah.
And then the others are used, obviously, for the district and the...
Yeah, the others
and
are
the
occupied by
county.
full-time judges, correct?
And those are occupied how often?
The other courtrooms?
Mhm.
I would say it is not unlikely to have 3 courtrooms running through the bulk of a 6-hour window in a day 75% of the time, where you could go over there and have Judges Plewe, First, and Lawrence all on the bench at the same time for a considerable portion of every day.
6 hours a
Yeah.
day. So those 3 are pretty much used
Courtroom 1
pretty much all
is
the time.
Courtroom 1, with the exception of a Thursday where a jury trial may go off for county court, is pretty much in use from 9 a.m. until 4:30 p.m. almost.
With breaks.
Yeah, but
Well,
almost.
right,
yeah.
but basically 6 hours
Yeah.
a day. So do you budget, and I don't know if this is a fair question or not, and if it's not, just say that's not a fair question. So we have 4, I guess, security, is that the best question or the best answer?
Security
for-
deputies?
Security
Yeah,
deputies,
courthouse
yeah?
security deputies? Okay.
Yeah, and, you know, we were recently just funded for one of those, for
From
one
the-
of those positions.
Yeah, from the grant.
So how do you budget for those, or do you budget for those in those courtrooms, or is that just a suggested unfunded mandate, or how does that work?
Do you mean, like, how do we determine how many deputies are necessary, or
Yeah.
how do we determine how many?
How do you determine that?
So I think the sheriff is probably the one who should determine how many
Oh.
deputies are necessary to cover the courthouse.
Okay.
So we do not,
Yeah.
the
That funding comes from, I'm sorry, I don't want to interrupt, that funding comes from a separate statutory legislative long bill item that's outside of the judiciary's primary funding
Okay, and the
for
reason
court
I
security
asked
officers.
was when you said you were at 1.25 for a judge, I was just curious, is there do they have a way they calculate that?
No, we rely on the sheriff to make the determination of what's necessary to secure the facility, based on a couple of things that they kind of have to do, based on the statute that requires him to secure the court facility. So that statute requires the sheriff to be the statutory authority to secure the courthouse and provide the security. So then he would make the assessment of how many deputies are necessary based on size, scope, relevance of the facility, right? So that building's about 30,000 square feet, has 4 courtrooms. It's about 380 plus feet furthest end to furthest end, right? From probation, intake, reception, all the way to courtroom 4 on the other end. With that, we obviously have the main entrance, which is open 7:30 in the morning till 4:30. Well, it's open till 5, but the clerk's office closes at 4:30. But from 7:30 in the morning till 5 p.m., the front door is open for anyone, for the public to come in. So we have a necessary person to obviously do that, right? To screen
Right.
and run the magnetometer, run the x-ray machine, and screen people as they come through. We have 55 or so cameras across the facility, both internal and external, including holding cells and associated space. Really takes a deputy to monitor that, right? Monitor perimeter and interior movement of the facility. So you have 2 guys wrapped up in just
Right.
that.
Just right at the front.
Right, just right at the front. And so then, I think the determination the sheriff has made is that it takes, probably more than that to then make sure that if something happens in a courtroom, which I'm sure you've seen, we've had some skirmishes recently. People have been taken into custody, said some officer involved, detainments where we had to actually lock the doors to the building because we didn't have enough people to secure it while they responded to the courtroom because we had some parties who were out of control. But ultimately, we leave that determination to the sheriff. I think he has landed on, to give our deputies breaks so they can have a lunch break, so that they can maybe rotate some of their duties so you don't have some burnout in what you're doing. I think he's established that number at 4. But I would want the sheriff to defend
Sure,
that
that's-
number himself.
that's fine.
But, yeah.
So I think, just to follow up with what Eric said, when court is in session, we do not have an officer in each courtroom.
Correct.
And
No,
we
I-
don't require that.
Yeah.
I don't
Right.
require that. The way it works is if I need someone because I feel a situation is going to be elevated, and frankly, I've been doing this a long time, so I'm a pretty good judge of when things are going to get a little wild in here, then we have the ability to ask one of those deputies to come into our courtroom, and that's what we do as judges.
Right.
Got it.
So,
And that's the discretionary piece that all of the judges use, which is we don't require them to be present, but if we know we have volatile parties, if we know we have at-risk defendants in the courtroom, or we have kind of high-stakes cases where emotions could be high, we sometimes ask deputies to be present, just as more as a diffuser, right, than it is to be responsive. Right? Would rather diffuse the situation before we get to it than have somebody have to respond to a situation that is unfortunate.
so if I have a high-profile case where I think I'm going to have a lot of people in there, I have a good enough relationship with the sheriff's office where I'll say, hey, could you give me an extra person in my courtroom to basically
Yeah.
provide a comfort level
Yeah.
for everyone, and he
I
does that.
understand. That answered my question.
Okay.
I was just, and you gave some examples of square footage, so on and so forth, so yeah.
I will say
I got
this,
it.
we were very grateful that we did get the court security grant this year. We worked hard with the sheriff's office, worked hard on that, and that was great. That's big for us.
It
So-
was.
No, it is, and again, I appreciate that. It was,
Why we didn't get it the year before?
Scoring grid based on, and I shared some of that with the sheriff in.
see, and I don't get that. If you're pushing judges up to 1.25 and you've moved the category and you're going up
Right.
and they pull the funding away, it doesn't make sense to me. I guess that's why I'm asking all the questions. It's like, there's no logic in that.
Right, yeah, and so
What is the
those,
logic in moving categories up and they're at 1.25, we got to get to 1.35, but then you're pulling their funding away? If you can explain that to me,
well, it runs on two different metrics actually, and so what it runs on is that there's the assumption that as a county becomes a higher class county, that it has a more stable economic piece, right? There's more money.
so
in
now
it.
you sound like the state legislature.
Right, no, I'm just, that's how they measure it. I mean, I'm not saying I measure it that way, but that's how it's measured.
Yeah, we're gonna run into difficulty. I will just tell you.
By moving to Class B, yes. I mean, that's how they measure it. Not me, I'm just saying
No,
that's
no,
how
no,
they do
I-
it.
I
Our
understand,
we
and I'm
measure
not-
our workload separately than the legislature measures our workload, right? Right. We hire a vendor, they come in, they do a comprehensive study, we do a time study. We require all of our judges to track everything they do for 4 weeks. Every minute of everything they do, we track. We take all that aggregate data and we give it to our vendor, and our vendor then produces a workload model that says, on average, a judge in a county like Montezuma County takes this much time to do their workload, right? That's how we create ours separately than how the legislature is measuring your economic stability and what you're entitled
Yeah,
to.
yeah.
As that, right, yeah, I don't want to, I want to separate myself from that measurement piece. And
No,
that
and-
we don't have anything to do with
Yeah,
that, but I
we
do
really
understand.
don't. And it is a frustration, and the only thing I can say is I would encourage you all to talk to the legislature
Yeah.
about
Uh-huh.
that piece, because.
Oh, we do.
Yeah.
Because
Trust me.
we are doing the same thing, but, on our end.
I will say I am one of the loudest, probably, people in the court executive community in the state of Colorado that squeaks really, really loudly about resources for rural counties, measurement tools for rural counties. I was just on a phone call this morning about it. I squeak really loud about the court security grant funds because of all the counties that I have in Southwest Colorado, 4 of them qualify, Montezuma being one of them. So anytime the ball changes court, it impacts places I work and do business and work with counties. And so I do have a fair bit of passion around making sure that resources for rural counties, for things like this, court security, underfunded, which helped provide the facility we're in with the county's help. Those are things that are really important to me. and they've been really important to me. And I continue to use the voice that I have to support them and to make sure, which is how, I had a conversation with Wanda and the sheriff earlier this year about what we need to apply, even though we didn't get anything last year. The scoring grid is different again. Let's go in for a grant. And so we were successful. I'm thankful for that. I'm hopeful that we can continue to put more money into that. There is a lot of pressure on the legislature, and this is where I would encourage you and the county commissioners and your statewide association to put pressure on the legislature, continuing to put more money into underfunded courthouse funds, court security cash funds, things that you can directly access to help. Underfunded money does not always have to be just to build something new. It can be for other things. We've used it for substantial refurbishment in Silverton and San Juan County. So I would encourage, to keep in mind that there are other uses for that money beyond just new construction. So.
Yeah. And thank you for your help and working with Wanda and the sheriff's office for at least getting us that one portion of that, because I like how you eloquently put it as a judge. It's a suggested unfunded mandate. It's like, come on, guys. So anyway, I'll be done now, and I'll let you go back to finishing what you were talking about.
No, we appreciate it.
No, this is the kind of dialogue that we anticipate to have when we come over. I mean, I think this is healthy for us to have these conversations about, what our roles are and the things that we do and what we know we require and what we try to return and help, and to hear, the position from the county, and so we have an opportunity to respond to it. So it's helpful for us.
And the one thing that I would say when it comes to court security, it's not, let's try to protect Judge Plewe and the other judges.
No.
When people come over to that building, that is some of the most, it's one of the most stressful times of their lives. And to have those security deputies there really makes a difference for the community generally, right?
Yeah.
And they do a really good job, and we do appreciate them. And I get it. It's not, it's money. And that is...
And I do understand that. Trust me. I mean, we at times have this room filled up, and we can walk out, and it's like, oh no, what happened?
I'll pass. I'll
So
pass on that.
so we totally understand that,
Yeah.
but still, again, when we're starting to put together budgets, and like I just, we were talking about earlier in RAR, your RAR goes down, but now we're moving to
We're a bigger county.
a
We have
bigger
more people.
county, and now it's just.
And our
It
numbers.
grows, but my RAR is going down. Tell me how does that work? How do I make that work?
That's why you're sitting there and I'm sitting here. Because our case numbers are going up and are going to continue to go up.
Some days you really wonder.
Right, I mean, we're experiencing that same thing we're talking about. We have this case growth, right, and we're trying to manage that case growth with the amount of resources we have, which is not increasing, but yet we have an increased amount of workload we have to figure out how to manage. And no one's going to take the answer of, we can't, right?
Sure.
Like, the community's not going to accept that. Then we say, we can't hear your case in the amount of time that we normally would hear it because we can't. I mean, that's just not an acceptable answer. So we find ways and we work harder, and this is what we do.
Yep.
Are we
All right, so.
getting close to messing around with the speedy trial rules? Are we getting,
We're working hard.
yeah,
That's what I would say. We're working hard. We're not losing cases to speedy trial in this county. The judges are working hard, the staff is working hard. That's not an issue for us. I would say that the issue for us is our staff is taxed more than they have been in the past. That's where I think we're seeing that. I'm sure you're seeing the same thing, right? Because you're asking employees that you have, just like we are, to do more. And fortunately, we have great employees. That's, I think, where we see it the most.
It's a stressful job. There's high turnover. We've experienced quite a bit of turnover in the last probably, COVID started some of that turnover, and it didn't really stabilize after COVID. So post-COVID, we haven't really had the stability in the staffing that we wanted over there. We were, for about 24 months, recruiting nonstop. for jobs, and as fast as we could fill, we were losing people. That then takes away our base institutional knowledge of our folks in our office, and it requires more of the people who have been there longer, who know more, to then not only be mentors, but then take on additional duties, share in the work that is the others that just don't have the capacity to do. So
We're working harder, and my golf game is getting worse.
I
That's
just
the
quit.
I think Eric has just a few more.
Anyway.
things.
yeah, I do. I don't want to take up
Go
an
ahead.
enormous amount of time, but I alluded to, and Travis and I had met last year to talk about just the maintenance, housekeeping costs of the facility by reducing our contract to, I think 3 days a week is, I believe, what we went to as a way to try to mitigate some of the costs that it takes to operate that facility, as well as some of our go to sleep time, awake time for the building for both HVAC and for lighting. And so I just kind of wanted, it's been working well for us. We've had a couple of days where housekeeping, where we've had just back-to-back big jury calls, and it has been a bit much. And the maintenance guys, though, have been fantastic. They've come over and stepped in and did a little bit of stuff that we needed to, but we're working the 3-day kind of housekeeping schedule, so hopefully there was some return to the county and that additional savings by going to that type of contract. It worked well for us as well. So, we're thankful that we were able to partner. Travis and I have met several times on some other things. We have a meeting coming up next week to talk about, I think, just generally operating in the building, cameras, our doors. The facility operates with a fair bit of security, and a lot of the stuff that we operate in our back hallways and our other hallways and our exterior doors are one step below detention grade hardware. So we don't have full detention grade hardware except for our holding cells and our Sally ports that lead to those holding cells. Everything else is one grade below, which is expensive. We're coming up on 7 years being in that building, so we're starting to see some cyclical lifetime failures for just things that normally happen in a building that has high usage, high traffic. And so I think we're going to try to come up with some solutions next week to talk about how we can transition away from some of the things that are in place now, still maintain a fully secure facility, but not have to rely upon contract vendors to come in and do some of the repair work. There have been several occasions over the last several years where I've tried to help facilitate some of that cost sharing. We just added a reader to a door on the end based on court security, kind of that length of building. They have where they patrol the outside of our building every couple of hours. They do a perimeter assessment all the way around, one of the deputies does, because we have lots of people who have started to linger and gather in places where we'd rather them not. So court security does a sweep around the building. And we have a doorway all the way, it's the double doors all the way by door 4 that you can go out, but you can't come into. And we had an instance where the deputy was outside, something inside went wrong, and he couldn't get back into the building without going all the way back around to get back into the facility.
To the front.
Yes. So, that is just kind of a design piece. It was designed like that when we initially built the building for a reason. We've determined that it's not a great design. And so I've actually picked up the cost associated with adding that reader, the programming, the hardware, the purchase that goes with it, just because I know, Travis and Dustin have been pretty transparent about where their operating costs are at for the facility, what their budget looks like. So I'm trying to help mitigate some of that and pick up some things that I think I have the authority to spend state funds on that won't be problematic. And so that's one of them. So we're going to pick up that reader as well. So those are things that I look forward to our conversations on, and how we can transition to something that maybe some of your own county personnel can maintain and upkeep or program and utilize, versus having us bring in vendors to do some of this work. As it stands now, we have a vendor that's basically, the software is proprietary, it's linked to a vendor, and they only have the access to do certain things. And we're going to try to hopefully move away from some of that in some of the building, to ease up some costs as well for that. So on that note, I do have one request with some prairie dogs.
Okay, so what we are doing right now, and I know because we've had the same conversation. So there was a request for more parking.
My apologies, I thought I had it off.
And I can't.
At the courthouse?
At the courthouse.
Do you know?
And
that
then
just
we were-
come from me. Or
No, so what, we're trying to do some restructuring of that facility and the sheriff's facility with solar.
okay,
So we're trying to incorporate parking with solar and actually coverage so that we actually get rid of a lot of prairie dogs, and it will be black and parking for everybody and covered with more solar on it, so that it does help offset the cost of, because you guys are a big consumer, the sheriff's office and the courts are a big power consumption.
yeah,
Um,
30,000 square feet running,
No, I
you know,
get it.
5 days a week. I mean, I get where
We're
you
just
use it.
trying to figure out
Yeah.
another way to help offset that too. And, because we've talked about it, is to get rid of some of the prairie dogs and to get that landscaping taken care of. Now, is it gonna take care of all of it? No, but,
If you could take care of all prairie dogs in Montezuma County, you would be legendary.
Right.
We know that's not, we know
Not
that's
gonna
not
do
gonna
that.
happen. We know that's not gonna happen. It's just getting,
yeah,
and you know that, because you're over there. I mean, it's-
okay. We'll definitely look into it, but we are working on some stuff.
You are not alone.
Oh, I'm sure.
we're not.
I'm sure we're not alone with that. You know, with the way the landscaping and the way the building is designed, the way it was perched up, we did a lot of dirt moving, which I think created an incredible habitat for them to come into, because we disrupted a lot of native soil there when we built that building.
and I also think
So-
that the apartment building going in to the south
Has driven him
and
over
Yeah.
there.
west of us has driven them to us.
Mm-hmm.
And
So
that-
we will look into it. I know there are some different things. I mean, I've got a veterinarian here that knows how to fix things, but maybe he knows how to kill things too, so.
Well, we'll leave it
Uh,
on.
maybe we can-
We'll leave it.
We appreciate the audience with it for that. If you have questions on parking, or Travis, anything that I can help with as you get down that road. Obviously, we advocate for some additional parking. You can see what our jury days look like sometimes. You know, we have people in the Osprey lot, you know,
And-
up and down the street, so.
We've seen that also, so it kind of,
we're happy to talk with you.
Yeah, absolutely happy
and
to.
hopefully we make it happen prior to a decade.
That would be
How's
helpful.
that?
Any other questions for myself or for Judge Plewe?
I
on
don't
anything?
think I do right now. Thank you,
Okay.
guys. I do appreciate it. I know we don't get to see you very
Yeah.
often, but it is helpful to have a conversation periodically, because,
And anytime you need one of us, both of us, to come back for anything, please don't hesitate, reach out,
Yep.
ask, and we'll be happy to come over and do the best we can to answer
And
questions.
we do appreciate, you know, the open communication we have with Travis, and we're grateful for that. Thank you.
very good.
Okay.
Thank you, guys.
Thank you.
Gentlemen.
Thanks, guys.
All right, next up, we have Southwest Health Systems, SHS update from Mr. Joe Theine. Welcome, Joe.
Thank you. Thanks for taking some time together. Good to see you all again.
Yeah.
I'll give you some updates, interrupt as you feel free, and certainly have time for questions as well. Just want to highlight some of the things that have been happening over the last 6 months or so, 4 or 5 at least, since we've last seen each other. Travis, if you want to go ahead. So had a lot of focus on provider recruiting since I started last fall. Just want to give you an update on our progress. So since August of last year, we've had 80 candidates, mostly physicians, some advanced practice providers taken interest. We have 6 that are active, and you'll see in a moment why that number of active candidates has started to get smaller rather than bigger. We have had 21 interviews scheduled and completed, made 16 offers, 15 of which have been accepted. And we've had 3 physicians or providers start since the beginning of the year in important roles. So Rebecca Moore started in internal medicine in January. We had a podiatrist who started at the beginning of June, Chris Jetter, and a family medicine physician who's worked on the Hopi Reservation and is dedicating her practice to older adults and those with multiple chronic conditions. And she's lived in Mancos for some time. Her name's Jocelyn Hirschman. So a good effort on the part of recruiting. And this has been a community-wide effort. Friends of the hospital, an informal group, our staff, other community members have really helped show off the best that we have to offer. Travis, if you go to the next slide, in December of last year, we took to our board a recruiting plan and asked them to dedicate the resources to bringing in physicians in a number of different roles. And what you'll see in the status column are two different colors of green. A darker green indicates that we have a physician where all parties have signed a contract. We have a definitive start date. You can see the name of the person coming and when they've either started or anticipated to start. There's a general surgeon who we're under a letter of intent with, and so when that contract gets wrapped up, we'll fill in the blanks there, be able to share who that is and when we anticipate them coming. And then we're still looking for one more individual to serve in a family medicine OB role. So when I said that number of active candidates is getting smaller, it's because at this moment in time, we're really just recruiting for one physician role, where when we started this effort, we were looking for a number of physicians. So again, great work on the part of a number of people to bring us here. When we plan for the hospital for this year, we plan to increase the care that we're providing to people in the community. When we plan for the year, you can see in different categories of services what the percentage increase from 2023 to 2024 is anticipated to be by the end of this year. Some of the percentages are higher based on small volumes. So births we expect to be in the middle of a normal range of deliveries for the year. Swing bed admissions, the admissions are relatively low, but the number of days a patient stays in the hospital are usually longer. The other notable piece is the rural health clinic and specialty health clinic. Early last year, we were still operating out of a clinic on Park Street. It was not a designated rural health clinic, and so it didn't receive the type of funding we get in a rural health clinic. When we moved that practice into the hospital building, we moved them into a rural health clinic setting. And so that specialty clinic represents for us anything that's not in an RHC or rural health clinic status. When we look at the total clinic visits by the end of the year, we expect them to be similar across all of the settings that we have. If you go to the next slide, you'll see where we are year to date, and this is through May of this year. And you'll see some things are holding close to where we planned, some things are not. Labor and delivery is increasing every month, which has been great. The last couple of months, we've been around 13 to 14 deliveries, which is a pretty average month for us in any given year. So that's returning to where we would expect it to be. And again, you can see some things are a little bit higher, some things are a little bit lower. I circled the adjusted patient days. When we look at the hospital activity as a whole, adjusted patient days take into account all of the services provided at the hospital and adjust them to turn it into the equivalent of a patient day in the hospital. We plan to be at about a 5% higher adjusted patient days by the end of the year, and we're tracking to that overall. So while some services are higher and some are lower, when we look at the overall hospital and where we had hoped to be, we're pretty close to on track overall. Talk a little bit about our employee retention rate. So you'll see in the last month that we measured this in May, that ticked up just a little bit. The line that goes across each dot is the last 12 months of employees that we've retained, our retention rate. And then each bar represents the number of separations for any cause at all. And you'll see that from late spring, early summer of last year, in any given month, we're retaining more of our employees, and that's starting to show on a long-term trend. Not depicted, I don't think I have a slide for it, as our nursing, but we've retained all of the nurses that were with us in January are still with us today, and we've reduced the number of nurse vacancies and contract labor, so we're at about the lowest nurse vacancy that we've had in over a year.
So let me ask you a question on that real
Please.
quick. So last June, you had, if all those three spikes there are in June, correct? Is that how I'm reading that?
April, May, June are the three high months
The
with
three
individuals.
high months?
Yep.
Okay.
And you came
What-
on board when?
End of July, materially at the beginning of September.
So we've tapered off,
Yeah,
so
you can see
with the
that's-
changes
Yeah.
that's
Yeah.
happening, okay.
Yeah.
I'm
And-
reading that right. Okay, thank you.
You're welcome. As we talk about how we're going to fund the hospital in the future, we recognize that the community is giving a lot through a sales tax to the hospital district, which helps us pay back some of the debt associated with the building that was done and finished in 2018. As we look to the future, we know we're going to have multiple streams of outside funding, really common for hospitals in rural communities to do that. And so we've become more active both in the philanthropy area through our foundation, but also through state and federal grants that are available. So what's listed here are different things that we've either applied for or received monies for through, again, either our foundation's activity or some type of grant funding. I want to thank the county and the commissioners for supporting our application for a congressionally directed spending, both to Senators Bennett and Hickenlooper. Both of their offices have indicated that they've moved our project forward in their priorities, so it should be going to appropriations when that process starts later this year. We also are benefiting from some technical assistance. Our board is getting ready this fall to do some longer term planning for the hospital, and through the National Rural Health Association, which is funded by the USDA, we've got a consulting group called Stroudwater that's coming in and doing a really broad-based financial operational assessment to help inform what we may be able to do in the future. So a lot of good activity to bring resources in from outside the hospital and outside the community. Want to share some fun things that have been happening in and around the hospital as well. So this spring, we were able to recognize Lil Bostrom. She's been a nurse for, I believe it's more than 40 years, both in the community and in her career. She currently works in and around the operating room, and she is somebody that probably runs circles around a lot of the less tenured employees in the organization. Our medical staff came forward, our anesthesia providers and surgeons, and asked both the board of the hospital and the health district to dedicate one of the operating rooms in her name. And so at the beginning of Nurses Week, we were able to celebrate Lil's career and dedication to the community and officially name one of the operating rooms after her. So we were really excited to do that to kick off Nurses Week. The next slide. We had a wonderful hospital week, so every year we celebrate the hospital's contribution to the community. A lot of the activities we do inside to really celebrate the staff and the employees and celebrate this with them. This year on a Friday afternoon, we opened up the hospital to the community. We're available to give some tours. We had our partners with Classic Air land their helicopter out in front for people to come through, had a bouncy house for kids to go through, and serve lunch to the community. And we had over 330 people come and have lunch and celebrate the hospital and all the people doing great work. So it was exciting to see the community
We couldn't
come
get
out.
our county attorney out of the bouncy house when we walked by it.
I think he was around the helicopter as much as the bouncy house.
True.
Well, there's a kid in all of us. Go ahead, Travis. Another exciting milestone that we're going to reach. A year ago there was a lot of discussion about the need to re-roof the hospital. We will have wrapped that up materially. If we didn't at the end of last week, by the end of this week. I don't recall when the walkthrough scheduled, but we were talking before the meeting started about all the rain. We had most of the roof done before all the rain's been hitting in the last couple of weeks, and nobody's reported any leaks to me. So I think we've closed our indoor water features for a little while.
Good.
The other note on our roofing project, when we had bid it out originally, we had about $1.5 million cost to it, and when we went back and rebid it and leveraged the purchasing group through our management partner, we were able to get that cost below $600,000. So we saved the community over $1 million by working with our partner in Community Hospital Corporation. We've also had just a great response from the local journal. Really appreciate our colleagues in the newspaper industry sharing all of the news at the hospital. And so you can see a number of different headlines, but they also represent a lot of the great things that have been done in the hospital. We currently have a grant from the Laura Foundation that's hosting older adults to have lunch. Most days if you come into the hospital, there'll be anywhere from 20 to 30 or 35 individuals that are coming gathering. Usually one day a week there's a guest that's there, and it's not always a guest from somebody inside the hospital. We've had community members come and sit down and have lunch as well. So if at any point in time commissioners or staff would like to sit down with that group, we'd be happy to facilitate and give you an opportunity to spend time with community members. You can see we also dedicated the ambulance building to Fred DeWitt before he passed away in honor of all his work in the community and for the hospital. a couple of months ago now, we welcomed a permanent CFO, and he and his family have relocated to the area, and he's hit the ground running and doing a great job. So a number of great things that the hospital's leading in the community. Want to turn our attention just for a brief moment to some of the things that we're actively involved in at a state level. So there's an active group of hospital CEOs that really wants to stop kind of complaining about all the things that are happening in the state legislature to rural communities and rural healthcare and start developing a proactive agenda. And so led by Kevin Stansberry, who's out in Hogue, there's a group of 6 of us that are really working on a proactive legislative agenda for the state of Colorado for next year. So I'll walk you through just a little bit of that work. If you go to the next slide. So this is the core team, sorry, it's 7 of us, and we're from all different corners of the state, so some in the middle of the state, Jason Amrick from Gunnison, myself in southwest Colorado, Jennifer Riley's up in the northwest corner, Dwayne Pace is up in the northeast. So we kind of got different areas of the state covered from a rural and frontier hospitals perspective. If you go to the next slide. And really the piece that we want to help our legislators understand is that if you've been to one rural community, you've been to one rural community. We don't want to sit back and admire the problems that exist. We actually want to address them. And it comes from a place of where you live shouldn't determine what your health is. And so those are some of the guiding principles that are really kicking this work off. There's a couple of different aims that the group has. So the first is to perform a root cause analysis, and I've just seen the first draft, and some of the things are really intuitive about why there's struggles in rural healthcare. Some are payment models and systems, but we really want to understand in rural Colorado what some of those challenges are. We want to understand in similar states with similar legislatures, similar politics, what are policies that have made a positive difference that might actually be able to work their way through our legislation and turn into good policy. Prioritize some of what those might be and then actually work to enact those in the following legislative sessions. The next slide, the way we're going about this work is we have raised money from within our own hospitals and from the Colorado Health Foundation. So every hospital in the state of Colorado, whether it's rural, urban, specialty, for-profit, nonprofit, has contributed financially to the effort. And we've contracted with the Farley Center, which is a policy think tank up at the University of Colorado on the Anschutz Medical Campus. And Lauren Hughes is leading that work. Along with Liza Creel. If you go to the last slide, I believe it is. There's, as I mentioned, there's 3 or 4 scopes of work. One of those scopes of work is done in terms of doing some research. The work that they're now doing is interviewing key informants from around the country about their experience improving policy in rural Colorado. And throughout this year, in addition to the research that's being done, we're also starting to build the narrative with our elected officials so that as we're meeting with them, we're letting them know that this work is underway and starting to build a coalition of support for rural communities and the healthcare needs that we have. So those are a lot of the things we've been up to from within our community to within our state. Happy to answer questions.
Sounds good. I mean, what do you see as impediments to your creating this group? Is there any that you've encountered already? Interestingly, had dinner, I think it was back in March, with a number of our elected officials. We were up in Denver for a state association meeting, and the senators and representatives were all from more urban parts of the state, and that was actually very intentional because we wanted to be able to share with them how important rural healthcare delivery is. And at one point, one of our elected officials said, well, where are all of our rural counterparts if this is so important? And politely shared, they're supporting us. We have their support in their ear, and what we do need are the representatives from the more urban parts of the state to recognize the value. And the anecdote that we shared was, how often do people from Denver, Colorado Springs, Fort Collins travel into the mountains to recreate? And what would happen if there weren't viable rural hospitals in that part of the state? What would your constituents think? How would they feel about where they go to vacation travel, invite friends and family to come visit our wonderful state? And so trying to make the rural part of our state just as important as the urban when we talk about healthcare delivery systems.
Very good. I mean, I don't have any
Yeah,
questions.
It's
at
a
this
long
point in
ways
time.
for them to travel, but they don't think you go very far.
No.
Yeah, it always seems that way. You know, we travel up there all the time,
Yep.
but seldomly do we see them down here.
For vacation on
On
occasion.
vacation, seldomly do we see them though.
Yeah.
So, yeah, I get it.
Well,
Understand.
thank you for your support and time. Very much appreciate it.
All right, thank you.
Thank you, Joe.
You're welcome.
Have a
Appreciate
great
it.
day.
Yep, have a happy 4th.
You too. Next we have a discussion as it's related to the fixed route feasibility study. Ms. Morris, come on down.
Good morning. I didn't send you guys a copy of this, but I did print them out. So you guys can look it over, and I highlighted a couple of places, but it didn't take. Did I get
One more.
did you want one? It looks like.
Yeah, we'll share. Is this the same one?
Yes, we did get it. I did send it. So we finally got the results back. We're pretty excited about that. The reason I wanted to just talk about it with you guys and give you a copy is because I think this is going to be a good thing for the community. I mean, he put population statistics, he put the 2021 commuters, what the commuters were from Dolores, Durango, Mencos, Cortez. And then the other thing I wanted to show you, let's see. He did 3 different scenarios, and it's on, I think it starts page 20. So this is alternative 1. So basically, we'd be running 7 days a week, 8 to, I think he put 8 to 7. And that's between Dove Creek, Dolores, Mencos, Durango, and then we're going to see if the national park wants to. I know they bus their people up there, but if we could kind of, get them to the bottom of Mesa Verde to maybe have that, available for them. So what he did, I'm trying to. Oops. So it just shows how many hours per day, per week, per year that we would do the round trip. And then basically $45 an hour is the cost, and then $196,560 would be the annual cost. And then he did, like I said, 2 more alternatives. On page 21, there is local Dolores, the same scenario, but he did less trips on, he gave me 3 scenarios. The one where we go all day, every day to all 5 sites, and then hopefully Toyac. But he did cut down like the number of trips on them. Well, wait a minute, it looks like, did he do all 3 the same? No, okay. So like, the second one, and then the alternative 3 is a little bit less time we're going to the different places. So it's one of those things that we would look at maybe starting on the lower end and see how it goes, and then we can always upgrade to the more trips and the more hours. Does that make sense?
So, actually, I have a quick question. Obviously, just getting this put in front of me here. So the cost, the total cost, is that what? Is that with CDOT? Is that the CDOT cost that they will bear, or is that the cost that the people riding the?
So what it is it's the cost to run it for the year, and then we do have capital. We have the existing vehicles, and then what he did was he put the fares, that we have, so, let's see.
It's on page 23.
Yeah, so basically he did a new fare structure, and that shows, I mean, it still's $100, for Farmington, 75 for Durango. Oh, no, I'm sorry. Duff Creek is 10, 15 between Cortez and Durango. And, I mean, we'll still do our medical trips, obviously. But then let's see, he did a trolley option because we were kind of thinking, and that's on page 23 too, maybe having a trolley instead of a bus. Kind of like, I mean, we'll have a bus too, obviously, but kind of like Durango has, they have their trolley. I think that would make people, that would be, visible and out there, so, and fun, I think. So, yeah, 12 hours a day, 7 days a week. So, let's see. He does have the funding sources that we could go to. CDOT obviously is a big one. And then there's several that he put in here that we could get funding through. And I mean, obviously the 5311, which is on page 30, that's what we go through now, is the 5311. But there are different funding sources that he did find so that we could put this together. There's one thing I'm trying to find it. Like I said, I highlighted this before I printed it, but it didn't do it.
So I guess, Jennifer, without obviously going through this.
Right.
We're going to have to go through this, but what's your quick synopsis of what do you think the recommendations are going to be? I mean, there's a lot of differences here. I'm not sure to Farmington at $100 a shot, but it still might be doable, but.
Well, Farmington is just, I'm sorry, I didn't mean to interrupt, but Farmington is just medical.
Yep.
So Medicaid pays for that. Either Medicaid pays for it or they pay the $100 to go. So that would stay the same. We're not going to do the fixed route to Farmington. We're thinking more like from Cortez to Mancos. Dolores, yeah, and then do maybe one loop to Durango so that they can use their transit and then go back and pick them up. And that way, because I have a lot of people that want to go to the Social Security office, that want to go to, the stores, dinner, lunch or whatever. So that's why we're kind of thinking that Durango loop. And then, I mean, like I said, it would go like Cortez, Mancos, maybe do the park, drop people off at the park, and then head to Durango, drop them off, and then come back, and then do some route here, and then go back up and pick them up. So it's been something that has actually been in the works. We've been trying to do it for a long time. That's what I was trying to find. So yeah, it's something that I think, or personally, I guess, but that it would be a good thing to be able to get them to the Social Security office, to, Durango.
So when will you bring us back a recommendation and then the funding to go along with it?
This is just the first part of it, obviously. So
Okay.
At this point, I would need to contact the funders and see, who's going to do what. CDOT. I don't know if AAA would do anything with it, but I'm going to talk to them and see, if they can help with some of the cost.
I think AAA's funding just got
Yeah.
cut again already, so.
Yeah, we haven't heard anything about our
Okay.
funding yet.
I think we did hear it was cut. It was
I know
cut
they were
again to
saying that it
this
was going to be
area.
flat to last year, so the same as last year.
Flat.
Yeah, we did know that, so we just haven't got anything because the state hasn't done their part yet. But, I mean, a lot of this is going to be different funding pools because it's fixed route. So, we have to be ADA compliant, we have to have, the places or the bus stops, we have to have all that stuff. So it's going to be a different set of funding. It would be CDOT, but like I said, but it would be a different funding pool. So I'm thinking, I want to try, I'm hoping maybe to do it by late in the year, first of next year to start. So I'm going to say maybe I can come back like in a month or two with the recommendations and the information on the funding, if that's okay.
Yeah.
I just want to get you
Yeah,
guys a copy of this so you can look through it and it's clear as mud, right? So.
There's a lot to read, so.
Yeah.
it'll give us time to look at it. too,
Right,
so.
exactly, yep. And like I said, I printed it because I wanted to make sure that you had it. I thought I sent it out, but,
right.
and I do have another copy if you want one. No, okay. Okay, so
How's-
any questions?
How's the bus?
I don't want to talk about my bus. Don't know yet. It's up at maintenance. Shane said they're not sure. We've submitted it to our insurance, and then the lady gave us their insurance. And he said because it's so new, that they may not total it. They may just fix it. But I don't see how they can do that because it was crunched. All the airbags went off. The front end was just in pieces. So, yeah, but it'd be their insurance that covers that. I mean, it didn't even have the temp tags off it.
No, I know, I know.
I was heartbroken. I mean, we are getting another one from CDOT. So we'll have that van. But yeah, hopefully this will go quick and we'll get our van back.
How soon?
As far as getting it back?
Getting another one from CDOT.
All the paperwork's done. We're just waiting on them to tell us to do certain things. We have to submit some paperwork and stuff. And then, so hopefully, I thought it was supposed to be in June. So I'll have to find out for sure what they're doing with that. But we should be getting that.
Keep us posted on that. You can just email Travis and let us know.
Okay, yeah,
All right.
I can do that. And I'll keep you posted on the crunched one.
All right.
So,
Thanks.
any questions now? Okay.
No.
Thank you.
Appreciate it, Jennifer. Okay, Wanda, come on down. So this is with Chestnut Health Systems, part of the JBBS grant?
Help explain what the agreement covers and why. I just got this, so I thought it would really be helpful.
Is this-
Kind of understood. You can't, I can't talk about it.
So Wanda, do you want to start with an explanation of this, or do you want me to? Because I've looked this stuff over and,
Have you?
yeah, I'm not,
Well, I talked to Vicki, and then I talked to the people as far as the grant goes. And we are currently doing an assessment. When people come into the facility, the nurse does a quick questionnaire. This is just more in-depth, so that not only can they get the assistance they need while they're in the facility, but it also helps them when they get out to get more in-depth help with their problems and needs. So that's kind of it in a nutshell. I did talk with Access, and Access is going to be evaluating the patients. Their therapist will do it with the first meeting if they want help. It's on a voluntary basis.
and so basically what this covered entity data use agreement is this is an agreement that JBBS provided to our sheriff's department. And it's an agreement that allows for the sharing of patient data with this third-party entity, Chestnut Health Systems, so that they can collect data and formulate reports as to whether the program in the jail is working. I spoke with both Wanda and the sheriff last week about this agreement. This is a very legally problematic agreement because, in essence, what it does is it makes us make a lot of promises about data collection, data sharing, not sharing protected data, but the individual or the entity that's collecting all of the data is Access Health Systems. And so what this is doing is this is mandating the county to follow certain protocols and protect certain data that it's not collecting and that it doesn't have any control over. I'm very, very uncomfortable. I would be very, very uncomfortable if I was this board signing this agreement, because in essence what this agreement's doing is it's making us promise that Access is going to do something. And listen, this is nothing against Access, but anytime you're promising that a third party is going to do something and putting your neck out, it's never a good idea. Now, as I understand it from the sheriff, this agreement was presented to La Plata County, and they signed a different version of this agreement. I still haven't seen the version that La Plata County signed. I know the sheriff's working on getting that.
What they did when they looked at it, they saw the liability issues too, and when we are not the data users, or we don't have anything to do with it. So they, and I was hoping to have it today for you to look at, but they still haven't gotten me a copy from the JBBS people. They had Access sign the users agreement, and that's what Access is in the process of doing for us. And then they signed a non-users agreement, so they would not be held liable. It was all on Access. So I requested a non-users agreement so that I could show it to you, and I still have not received it. They said that it would be forthcoming, so I'm hoping to be able to get it to you. And like I said, Access is okay with signing it as far as being the data user.
And really the devil's going to be in the details on this non-user agreement. I haven't seen it, so I don't know exactly what it says. But what I can tell you at this point is that this covered entity data use agreement is not something that I would advise this board to sign.
And that's how La Plata County felt
I would be very, very, very uncomfortable. And after I looked at it, then apparently La Plata had the same concerns.
They did.
So that's where we're at. I think that at this point, I don't know when the non-covered entity agreement's going to come through. I mean, obviously, Access can sign whatever Access wants to sign, and we'll have to look at the non-data entity use agreement or whatever they term it. And then when I look at that, then we can certainly bring that before the board for a decision. But I think we wanted to get this before you guys so you were aware that this is out there.
It was supposed to start today. Of course, it hasn't because we haven't signed anything. They were really pushing us. And I went back to them and I said, I would like to see the non-users agreement so that I can get it to the commissioners, because that's what La Plata signed. And I did that a couple weeks ago and I'm still waiting.
So I wanted to get this before the board because this is going to create a slight delay. But as this is worded, I don't see any way that this board would be in a good position if they signed this.
So we're just on a holding pattern until we get that other agreement, so we'll make no decision on this tomorrow at all because we don't have enough information, and then we can evaluate it at that point in time.
Yes.
Yes.
Okay.
Okay.
We'll wait for more information
All
then.
right. As soon as I get it, I will forward it.
So while you're here, who collects the data?
Access collects the data. They will,
Okay.
this is, and I'll kind of just show you quickly. And it's all on the computer. And Chestnut, they're the ones that keep the data on their server. They're holding it and collecting it and then generating the reports, but.
That was my next one, is who holds the
They
data?
hold it.
They do.
And this is just, if you want to look at it, just rifle through it. These are the questions that they'll be asking,
Okay.
and it's totally voluntary with the people. They don't have to do it if they don't want to, but if they want extra help, then
They have
they're
to.
available for them. Say
Okay.
they have, and it covers mental health issues, it covers substance abuse, it covers suicide. Those are the type of things that it covers.
This is a great program, but anytime you're sharing this sort of data, transmitting this sort of data, getting this sort of data into the entity of third parties, you need to be sure you're covered. And this agreement doesn't get us there. So, great program. I'm really hopeful that we can get paperwork in place, but this
If we
is
had
not
all the
what we need.
information, it'd be a different story, but we don't hold all the information
No,
at
we
all.
don't.
We don't collect it,
No.
we don't hold it, we don't keep it.
Right.
And honestly, all we do is we hold the individuals in our jail, so.
No. That's why La Plata had the problem, and they said we
Yeah.
will only do it if we are the non-user, do the non-user's agreement, and access is the user, and that way the
They-
liability falls on them.
On them.
And we'll look at the,
Everybody being hacked these days. I mean,
I'll look at the non-user agreement because I'm interested to see
Yeah.
what that says.
I am
Because
too.
it's a little bit hazy to me how that agreement's gonna get us around the issues that I see, but we'll look at it and see.
Well, and if I can't get them, I mean, I'm thinking that they would want us to have it so that we could get this in the works. But I might see if I can reach out to La Plata as well. Maybe Gary Goudreau would send me a copy of theirs. We've worked with him in the past when we were sharing this grant together between them and Archuleta.
so who's the beneficiary of the grant? Sheriff's Office, us, Axis?
The
Chestnut?
majority of the monies goes to Access.
Okay,
And then we get a little bit for medications for the inmates and for, it covers some additional help with collecting all the data on our end that we have to collect.
Remind me though, Wanda, I mean, does the money come to us and then we pay it to Axis? So I mean,
Yes,
we're actually
yes.
the grantee.
We are the
Axis isn't the
grantee.
grantee.
No.
We're the grantee, and then we use those funds to pay a
pay
third-party
yes.
service provider, Axis.
Passing it
Mm-hmm.
to-
And so that's how it works. I mean, the money goes to Axis, but the grant is going to us.
Yes. So they bill us every month, invoice us, and then I request reimbursement through the grant and we pay Access.
Okay,
Okay, thank you.
we'll wait for further information. All right.
thanks,
Thank you,
Wanda.
All right, last but not least, Mr. Englehart, come on down. Looks like we have two different things to discuss. Some blade patchwork and Forest Service agreement.
Yeah, it's all the same, just keep it 2 different
Well,
periods. So if you want to start with the agreement first, then we'll do that, because that kind of ties in the blade patch. I don't care which one we do, just whichever one
sure,
you got in front of you.
that works.
So, back a couple of weeks ago, I was in here in one of the meetings, and I was on the 10th of June, and I mentioned that the Forest Service was trying to get some money gathered up to do some blade patching on the Dolores Norwood Road and House Creek. They're mostly fixed House Creek. And so since then, they've came back with this idea, and I think it's a great idea, to fund up to $249,910 over a 5-year period to continue that program every year. Instead of going through this every year trying to get it all organized, where do you want it, how much do you want, how many miles, what do you think it is, what do you think it is? And this money can be used in random values. It can be $200,000 all in one shot, or it could be $25,000 a year for a couple of years and a couple of 70s, or whatever you want to do to facilitate what we really need that year, which I really think that's a good idea. And it saves a lot of hassle with all this chasing around trying to get this all put together. This contract would expire in July of 2028, which is when our Schedule A agreements expire again. We would be renegotiating that 5-year plan. So this really coincides with that 5-year agreement that we just signed back in '23. So this being the first year of 5, we would be able to spend this money with that agreement, and then a new agreement would be put together for the Schedule A, and at that time, there would either be more funding or it would expire. The roads that are included in this are the Dolores Norwood Road from the Butler's Corner up to the county line, House Creek to the lake, and then West Mancus Road 42. That's from the turnaround up there on up to the top of the hill there that we chip sealed several years ago. That's the 3 main paved roads that they have that they want to try to take care of over the next 5 years. Other than that, it's just real flexible and it works, so I think it's a good idea. The bad news is, if you haven't heard, that the funding for the asphalt overlay on that road has been scrubbed, that $8 million.
Oh, we didn't hear that.
Well, you just heard it. So
So much for that.
I would advise you
Because
to
that was
sign this
supposed
so
to
we can
happen
get some
in
potholes fixed.
25, right?
Yeah. Yep. Money was spent somewhere else or sent somewhere else in this Build Back America plan that's in the federal government, and they've lost that funding. So I think they're scrambling to get money on the table now while they can for the next 5 years. There's even some conversation about some agreements with our crushing to help us in the county up at those pits at Ormiston and Beaver over the next few years, so we don't lose that money also. So they're thinking, they're forward thinking on this group down here to get us set up for a few years here to take care of the roads. So that's just another conversation for another day right at the moment. But this is real. We can fix this one right now.
So this basically just kind of lays it out and, yeah.
Yeah,
And
and
I think-
it's the same agreement that we have with them every time we do a pothole repair or anything else we
Right.
do up there. It's all same stuff, so.
Yeah, so this is just basically an addendum to the agreement for the 5 years
it-
that expires
I
in
don't even think it's
28.
an addendum. I think it's just an agreement we can do
Yep.
with our Schedule A agreements. You know, if you read the first page, it goes into telling us why this works and how it works, and it's not even really an addendum.
Yeah, it's a
just-
brand-new agreement.
Right.
Okay.
So has it taken consideration inflationary costs of oil, asphalt, and all of that? or just-
No, because if they would have, they'd have done it 5 years ago when we was up there paving. So,
Yeah.
Yeah.
you know, they live year to year, and I think this might be,
I just don't want us coming up short in the end. you know?
I think that's where we're headed if we don't forward think a little bit here, you know, to be
Yeah.
honest with you. I mean, if a 1 year deal works, but it's a lot of give and take. What are we gonna do this year? And you gotta get them in and talk to them about it, and they don't know. Their budgets don't come till later in the year, and they don't know what the money is. Well, they've come up with this money to lock it in for the next 5 years to fix these roads, so, and I think it's just
So
a
you
good idea.
you could spend it, and I think we're gonna talk about that in a minute, of the $50,000, or you could spend it all
Mhm.
at one shot if you,
Yeah,
if
and
they
I'm-
determine.
you know, they made that clear to me that this doesn't lock us in at 50,000 a year only. I mean, if we got a year that we have exceptionally bad weather, bad road damage, we can take 80 or 100,000 of this and move it right up there, fix that, and then skip a year or two and come back to it in a couple of years, so.
Kind of like
very
an agreement
flexible.
at the pit on Beaver Rim.
Yeah, pretty much.
We got $100,000 or 100,000 tons in 5 years,
Yeah.
however we want to crush it.
Right.
All right.
So this is a good thing in the road department's world. It just makes it a lot easier to plan and schedule for the work that needs to be done, so. Now, to do that, I don't think that the quotes are for me particularly, but I guess I'm doing a favor for them if they want to look at them, but I did get quotes on asphalt. We're not buying anything, they're paying for it, so it's not like it's anything more than for me to use over the course of the summer, because we want to do our own blade patching this summer, and here's the 3 quotes that will facilitate our work in August. So Elam is at $110 out of Durango a ton. Sand and gravel out of Dolores is 118, but their plant's down till mid-August. And then Four Corners is at 131. So to do this project for the Forest Service, I want to use Elam next week, actually the 15th, and get our trucks over there 3 trips over and back, and then we'll get this done for the Forest Service because Road H is settling so bad. We want to get that in before the summer's over, let these people use it safely. And then we'll go ahead and patch the roads while we're there and get on down off the hill there. So there's what I got. So.
I mean, I don't have any questions. You're gonna get 454 tons and $50,000 is what you're gonna spend. That's pretty much it.
That's it.
And you're taking the best cost for asphalt.
No.
Well-
The only one that's available.
Well, there are 2 available.
Yeah,
Out of the 2 that
best-
are
best on
available,
that one,
you're
yes.
taking the best cost.
Yeah.
And gosh, all the plants are in Durango now.
Well, Darren's still up here, but he's getting a new bag house, and it won't be operational till late August, or middle August. It'll be in time for us to do the chip seal, and we want to do some blade patching on the roads we're chip sealing. So it'll be in time for us to get that. It's a few dollars more, but we're quick to go around and get 2 rounds instead of 1 a day. We can hammer out more loads in a day, so.
Questions?
No.
And that's the contract to sign, Jimmy, tomorrow. It's marked there for you. And
So
I've
you'll
got-
need this one back?
Yep, I need
Okay.
to get it back. I need to sign it, and so does Forest Service, then we can initiate that contract, so.
I'll leave it sit right there so that I can give it to Ms. Purcell as soon as we
Okay,
approve it.
that's it.
All right.
Any questions?
Thank you.
Okay.
No, good, okay,
Thanks, Rob.
thanks.
Okay, with that, we have come to the end of our agenda, and we are adjourned. Thank you all.